Carlo, it's lovely to have you back here, my friend.
Thank you for having me.
What we about 18 months now after?
Yeah, we've done it in October 2023. Yes, yeah.
Yes. Tell me, how's it gone?
Beautiful. It's been a great experience, to be honest. You actually exceeded my expectations. It was great. It was a beautiful experience. I'm very happy with the results now. Yeah.
Okay, so tell me a little bit about what your original concerns were when you came to see me, so that other potential patients
Yeah.
who are looking for something doing, what was it that bothered you, and sort of how did you end up going through the process of picking the right surgeon for yourself?
Yeah. So it all started, like, just looking at it now, it all started like few years back before my surgery, where I don't know, it was a combination of things. I think I was going through some stress and different situation that basically led to me losing lots of hair. And I don't know, it really affected my self-esteem. I was feeling like really down looking at it. I wasn't happy with it. I couldn't really style my hair in the way that I wanted. And in that moment, I decided that I wanted to do, an extended research and see if I could do something about it. Because I was really trying like different products, but nothing really seemed to work. And I started doing my research. I definitely didn't want to do any of this kind of surgeries back in Turkey or something like this, because I don't know. I have difficulties already on trusting, doctors and stuff like that. So I really wanted an expert, and I really wanted to, do it if I would eventually commit to it, to somebody that was really experienced and somebody that I could basically trust. So Turkey was already like off the table. So I was like, all right, I might as well start looking at somebody like in London, which if I'm gonna be eventually like some complications to it, I can actually go back and do a checkup or anything like that. So it was more like, even on if anything would have happened, like, okay, do I have somebody that can look after me, and I don't really necessarily need to go elsewhere to do it. So that's where you popped up. You were one of the best, and after my consultation with you, it's been very clear to me that I had to do it with you, to be honest. Yeah.
That's very kind of you. So, I mean, I think, look, one of the things that I always like to touch base upon is that there's good and bad in any country.
Yeah.
There's some very, very good
Yeah.
surgeons, doctors in Turkey, as there are in the UK or other parts of the world.
Yeah.
And it boils down to research. I think, fundamentally, as long as you're researching the surgeon that's going to be specifically
Yeah.
doing the work, and you're happy with the type of results that they can achieve based off of your hair type.
course.
And it's what we was discussing a little bit earlier. You have got very curly, coarse textured hair with very fair skin. And this is some of the hardest hair to actually work with,
Yeah.
which is why, again, I think you was fairly apprehensive
Yeah.
when you first came in, because you said to me, Manny, look, the most important thing for me is naturalness, right?
Yeah.
I want it to look
Absolutely.
natural.
Yes.
I mean, I think you even said something about your mum also pointing
Yeah,
that out
absolutely. Yeah,
specifically.
my mom and most of my family was quite impressed. To be fair, like most of the people, like majority of them, I'd say 99% of people that I've got to talk with, they don't even realize that I had a hair transplant. And I think this is actually where you made a strong difference between, somebody else and you, because at the end of the day, like, it was very important to me, as you mentioned, to have a natural look and not to look like having like an airline that wouldn't really fit,
Yeah.
based on my age, based on my, on my hairline. And, it was just wanted to, I wanted to go for a very natural look, and this is basically what I've received from you. Yeah.
And I think what it also boils down to is we have to take into consideration your proportions of your face too.
Yeah, absolutely.
I think when you first came in to see me, I emphasized the importance of how.
It's really funny actually, because when I came to you, I had my own thoughts about it, and you quickly like changed my mind, which I really appreciate you in that sense, because looking at lots of video of these hair transplants and stuff, like you see people's hairline like changing completely.
Yeah.
And obviously, I thought like, well, maybe this is the way that I can have it. And then you quickly like dismissed it, but like in a very positive way, because I still remember that you really explained it to me why I couldn't have like a lower hairline, and I've really understood your points. I've remember when we had a consultation, you made me like
your eyebrows.
move my eyebrows just so you could see the creases, like, and the way that it moved. I still remember it. Yeah.
Well, this is the thing though. It's, you're an artist yourself,
Yeah,
right?
absolutely,
So you understand the nuances of art specifically.
Yeah.
And this is where I think people become a little bit unstuck, both as patients and as doctors in general. I think if you just try and do this cookie cutter, everybody's going to get the same thing. I mean, I had a patient that I was speaking to earlier who started asking me, how are you going to place the singles or the doubles? And I said, look, I can't tell you until I physically see what I'm working with on the day of the procedure. I can give you a rough guide as to how I expect the hair transplant procedure to work out and the sort of result that you can achieve too. But it's all about marrying up the proportions of the face. Your eyebrows are a little bit different. Sometimes your ears can sit a little differently. The length of the chin. So, we have proportions. So from the apex of the hairline to the midbrow, midbrow to the bottom of the nose to the bottom of the chin.
Yeah.
These are what we call aesthetic proportions. And the average person typically is broken up into equal thirds. So I have to take that into consideration. But I also have to make sure that as you get older, that the hairline is consistent with the aging process too. Otherwise, people are going to look at it and be like, he definitely had a hair transplant. And that's the worst. I've got a colleague of mine, Russell, and he coined the term the tube test,
Right.
And what does this mean? This literally means if you're walking on the tube, am I going to notice that this person's had a hair transplant surgery?
Right.
And I think, you tell me, I think that you would certainly pass that tube test because you'd be incognito. Nobody would know that you've had anything
nobody
done.
noticed it. They only notice it when I show the older picture of me. Then in that moment they'd be like, oh, right, that's how it was. Because they really can't see it.
Yeah.
And this is what I'm happy with. Because overall, I just didn't want to look odd. I wanted to have a very natural look, and I'm very happy with what we achieved, basically.
Yeah, exactly that. And I think ultimately, Carlo, it boils down to using other things too in conjunction with the hair transplant. So, you've got medication, which you're using at this moment in time. Tell me, a lot of people are frightened of taking finasteride specifically.
Yeah, I was scared at first, because obviously when you read information on the internet, obviously it tells you so many things, that it can cause it can lower your libido, you can have some sign of depressions here and then. To be fair, it's not really affecting me, even because I think the amounts that you're suggesting, I don't think it's very excessive. It's literally 1 tablet a week. So I think it's very doable. I've heard some crazy story of people getting 1 tablet a day. And to me, if that was the case, I think it would have been different, but you suggested a very low dosage of it. So it doesn't really affect me.
Well, your treatment dose is based off of your specific needs. And we was discussing this a little bit earlier too. I actually think that you're dosing yourself slightly incorrectly. So I've already said you need to take it twice a week at the very least, right? And you're using a 5 milligram tablet and cutting it in half, taking it on a Monday and Thursday. And I think, you know, I think everybody's dosing regime is
Okay.
specific to them.
All right.
Yeah.
Okay.
And I think ultimately your sweet spot is that 5
Right.
milligrams
Yeah.
in a week. Some people will be 2.5 milligrams in
Okay.
a week, and other people's will be 7 milligrams in a
Right.
week. So everybody is different,
Yeah.
right? But from your perspective of things, I think what you're, and you can correct me if I'm wrong, but what you're trying to say is that it was not just a off-the-shelf treatment, it was very much catered to your specific needs.
Oh
Is
yeah,
that
absolutely. Yes, absolutely. I think even the amounts of tablets that I'm taking, it does. There's a sense to it.
Yeah.
So yeah, I
Yeah.
guess yeah. Obviously, I'm not an expert. I'm following what you suggest because you're very trusted to me. So obviously, consider the fact that I'm very happy with the results. If you're telling me like you have to take half tablet every 3 days, I'm happy with it.
Amazing.
So yeah, because I do want to keep having the same results within time as well.
Yeah.
So
So it's all about long-term planning.
exactly, yeah.
And I think some of the other concerns that you also relayed after the fact, maybe more recently actually, is you know, and a lot of patients say this to me,
Yeah.
is, hey doc, I'm a little bit frightened because I'm seeing hairs in the bathtub
yeah.
and hairs in the sink and
Yes.
so forth. Now that we've discussed it a little
Yeah.
bit more, you know that it's actually kind of normal to lose 50,
Yeah.
maybe even 100 hairs
Yeah.
per day because they'll typically grow
Yeah.
back. So, you know, those are some of the concerns you had. Are there any other concerns that maybe
No,
you've...
it was mainly, to be fair, it was mainly just that because obviously at first glance, when you see some hairs in the sink, naturally, like it scares you because obviously you know, I've myself also, I worked so hard to have this as well.
Yes.
And I just don't want to go backwards. So this is why was my main question was like, is it normal to sometimes lose some hair? Because I've noticed it. So, but I've quickly understood through you that it's very normal, and I was probably doing some mistakes in the way that I was doing my dosage for the medication. So I'm gonna correct that, and yeah.
But I think
guess it's gonna be okay.
But I think this is part of it, though, Carlo. I think part of it is having access to your operating surgeon, right? You've
Yeah.
spoken to Russ a number of times,
Exactly.
and any time that you've needed to get in contact with...
Absolutely. I think this was one of the best things because every time I had a question, if I had any doubts or anything, you guys were always here for me. Russ was very kind to me. You've been very kind to me because I knew that you guys were passing informations, I guess. But every time I had a question or I had a doubt, I will just text you guys and then you will quickly reply and just make sure that I was okay with it. Because, you know, there can be like some moments where you have concerns and, you know, it's very good to have somebody that can assist you through the procedure because
It's a process, and I liken it to hand holding a little bit.
Absolutely.
You know, the first week, 2 weeks, you know, firstly the excitement of the day.
Yeah.
You get through that excitement, and then you kind of have that adrenaline crash over the coming days.
But like I think what really helped me as well, it's having a very set aftercare instructions as well. Of course, I had my fears coming up because it's not easy to handle the first few weeks after the surgery. So it's no joke. It's definitely no joke. Again, when I was looking at picture of people having transplant, I thought it was going to be much easier. There's a lot of work that we as customer have to do on our own. But yeah, if you're patient and you're willing to go through the aftercare.
The shed. Tell me about the shed, Carlo, when you shed after the transplant. How did you feel? You panicked a little bit? Even though I told you it'd be normal, everybody has that panic.
Like it was very scary because I was like, what is happening to me? Like, what's going on? And rather than seeing them grow, I'm seeing losing it. Like, and you know, also like even after just, you know, few days when the swelling starts, you know, coming down, I'm like, okay, what's happening right now? So that is, you know, few of them things, like, obviously makes you concerned.
And then you have your period of doubt where nothing really happens for a few months.
I remember that I had to wait for, like, I think I was a very slow growing, and I haven't seen great results till like probably 4 months.
Very
I
normal.
want to say. After 4 months, I could start seeing some gradual results, but then again, I think in that moment I talked to Russ again, and I was like, am I expecting to see more? Because obviously I was like, I wanted to see the final results, and it wasn't still there, you know? And Russ just told me, like, you have to wait and see, because, you know, like, the good results that you're finally gonna see, it's gonna happen like after a year or a year and a half. So you have to be very patient. You have to be very patient, but once you see them growing, you know, there's an excitement to it. Yeah, absolutely.
This is exactly it. And I sort of try and explain to patients, because sometimes people are actually frightened also of the fact that they have a hair transplant and then they think, you know, within a week they're going to have all this new hair, it's going to be amazing, people are going to notice. No,
that's
actually,
not how it works.
It's not how it works. It takes time, and it's a patient game.
It's a slow and natural process. Like, your hair actually have to grow. It's like planting a seed. You have to wait and see.
And you reap what you sow as well. So if you pick the right doctor,
absolutely,
if you do the research, and if the doctor takes the time to actually understand how grafts need to be handled, you can, I mean, we only did what, 2,100 grafts for you, something like that. And you know, you would have been quoted 3,000, 3,500 from other places. But you see, this is my point. I try and do the most with the least, and I think that helps to you're Italian, my friend, so Italian people, we discussed, have the best donor areas to work with, and you probably still got another 7,000 grafts or so that can be taken. But from my perspective of things, it's important that we'll just wait for that. Cool, I forgot what we was talking about.
I forgot.
It's all good. Look, from my point of view, I'm going to probably sort of wrap up here and just say, you know, thank you very much for coming in today. It's been an absolute pleasure. How are you?
Thank you for having me.
You know, we look forward to continuously seeing your results as they continue to blossom and flourish the way that they should be, you know. And you've been a great patient. I wish you all the best.
Thank you so much.
Do you have
Appreciate
Instagram?
it. Yeah, I do.
Can I give your plug?
Yeah, of course, absolutely.
So tell your plug. What's
it's Kilmoody, K1LLMOODY. Yeah.
Well, hence the Moody tattoo.
Yes.
There you go. Yeah. So great tattoo artist. People come to you from all over. Yeah. And he does a lot of great work. So my man, it's been an absolute pleasure.
Thank you so much.
No,
thank you so much for having me. Thank you for such an amazing service. I'm very happy with it.
You're more than welcome, my friend. Happy. You're more than welcome. And just stay in touch, you know?
Yeah, sure.
You've got our numbers, so just be in touch whenever you want to be in touch.
Absolutely.
Keep taking your medication. It's been a privilege and an honor to have you as a patient, Carlo.
Thank you.
Thank you very much.
Thanks a lot. Thank you.
Guys. Cheers.